Just a moment. Well, great. Well, thank you again for joining. If you haven't already, please sign in using the chat, sign in with your name and agency. We're so glad you're here. Today, we're continuing with our ALICE sessions through Data and Dish. So today's focus is on the senior survival budget. For those I haven't met before, again, welcome. My name is Jessica Davison. And then joining me today is Shauna Harris. I'll let her say hello.
Good afternoon, everyone. Thank you all for joining today's session.
Great, thank you, Shauna. So I know more folks are joining in. Welcome. Please use the chat to sign in with your name and agency. And just as a housekeeping note, we are recording. We'll share the PowerPoint, and then we'll also share additional resources at the end of the session. So no worries about the content. You'll definitely have access to this after today. So I always like to start these sessions with ALICE is people in our community. It is data, but it's also individuals and households and community members. So we want to keep that in mind today as we continue through this material. Today, we're focusing on ALICE and how it highlights the reality that the aging population is growing and that the living conditions and benefits are not always enabling financial stability for all seniors. So that's the focus of today. So we wanted to start with the Mentee Poll. So if you've come to our sessions before, you know we tend to like using Mentee. So if you can head over to mentee.com, you can either use your phone or use your browser, but you'll go to mentee.com and then enter this code, which is 3936238. I'm going to do it on my phone as well, just to make sure it works. If you have any questions, please drop them in the chat. On how to access Mentee, we can definitely help out there. Great. So I see that the poll is open, and I'm going to let you answer the first question here. So what percentage of seniors 65 years and older in the greater Houston area are ALICE or living in poverty? And so just a note for seniors, as we talk about seniors today, we are referencing those that are individuals that are 65 years and older. If for something we mentioned today regarding data might be 60 years and older, those individuals, we'll definitely make a note, but just, for the consideration, it's 65 years and older. So thank you all for who's going to our Mentee poll. So far, we've got 47 and 51% are coming up, but I'd love to, keep voting. See, about 10 people have made it to the poll. So 51 is kind of getting a little bit more traction there. Now we have a few more folks in the waiting room. We'll continue to let people join in, go to the Mentee poll. So that's mentee.com. The code is 3936238. And then there you'll see the first question. But so far, 51% is in the lead for what's the percentage of individuals that are ALICE and below as a senior in our 4-county greater Houston area. So that includes Harris County, Montgomery, Fort Bend, and Waller County. Give a couple more minutes, a couple more seconds, I guess, for voting. And if you are just joining, welcome. If you're having trouble accessing the Mentee code, you can also just use the chat to share your vote as well. So feel free to do that as well. But 51% is in the lead. Give another second or so. Okay, looks like we've got as many voters as we're going to get. So thank you all so much for participating. And it is 51%. Yes, 51% of seniors in the greater Houston area are struggling to make ends meet. So that means they are ALICE or living in poverty. Our next question I wanted to go to was, it's an open-ended question. So what are the day-to-day challenges among seniors? So those that are 65 years and older. So from your experience, you might know a senior, you maybe work with seniors. So from just your vantage point, what are the day-to-day challenges among seniors? Limited or fixed income, that's coming in. Transportation, access to healthcare, low income, yes, all. Social isolation, access to medication, isolation, food, that one's coming up. Access to basic needs. Food coming up again, income instability, access to healthcare, kind of see some trends happening with access to healthcare, medications, isolation, fixed income, income stability, transportation, food. Definitely, those are some existing day-to-day challenges. Transportation, lack of access to resources due to socioeconomic status. Yes, so y'all are definitely hitting on some trends and some issues specific to the senior population that we're definitely going to touch on. So thank you to everybody for going over to Mentee to sharing what challenges you're seeing for seniors. And we're definitely going to talk about that through the lens of the ALICE data. You know, I know when we first rolled out the ALICE data, there was some kind of misconceptions about seniors. Where do seniors fall in the ALICE data? Because of the acronym. So asset limited, income constrained, employed. So with that E, some seniors aren't employed. So does that mean they're not ALICE? And, you know, it was one of our volunteers who really coined the phrase, well, that E is maybe silent. So someone could be employed, they could be unemployed, they could be underemployed, and they still could be ALICE. So that's what we're really going to talk about today, just as the different landscape for ALICE when we intersect seniors. So thank you all. And I'm going to go back to the PowerPoint and I'm going to hand it over to Shauna to talk more about the senior population.
All right, thank you so much, Jessica. So, you know, as we stated today, we are going to be looking at some data and looking at ALICE, but specifically really trying to understand, you know, the costs associated with being a senior and the budget, of course, that's needed for an older adult to survive. But I wanted to do something before we dive in. I want you to think about the following question, okay? So where do you see yourself in 10 years? I'm gonna let you marinate on that for just a second. Where do you see yourself in 10 years? Will you still be working? Will you be retired or on the brinks of retirement? I wish. Will you be a caregiver to a senior family member? You know, what does your household composition look like? Who's gonna be living with you? How does that bank account look? You know, do you have money saved? You know, will you be caring for an elderly parent or a loved one? So what is your life, or where do you see yourself in 10 years? Okay. So there are a myriad of answers, right? You know, some of us probably are now taking care of loved ones, maybe, maybe, you know, you're preparing for retirement, and we think 10 years seems like a ways down the road, but in reality, we know how fast time flies. So in the year 2030, it marks a demographic turning point for the United States. Okay, beginning that year, all baby boomers will be older than 65. And this will expand the size of the older population so that 1 in every 5 Americans is projected to be retirement age. So later that decade, by 2034, it's projected that older adults will outnumber children for the first time in US history. So in only 10 years, the population in the United States is projected to reach 373.5 billion people, of which 19.5% or 73.1 billion will be 65 years of age or older. So wrap that around your mind, right? So we're going to be a grayer nation, right? You know, that is if Clairol, L'Oreal, Dr. Lovely, all those folks haven't gone out of business. So by 2060, nearly 1 in 4 Americans is projected to be an older adult. And so I know a lot of seniors, both personally and professionally. And one of the things that I hear them discuss the most is that, of course, they want to remain independent for as long as possible. That's, you know, pretty much everyone's desire to remain independent for as long as safely possible. So when we look at research and consider how the cost of living continues to rise, and then compare that to what it takes for a senior to make ends meet, you know, we really have to ask ourselves if seniors will be able to thrive, or will living in poverty if you're an older person become the norm. Okay, so today we're going to look at several areas to see what the landscape looks like within our state and locally for our elder population. All right, next slide. All right, so we see the senior population growing, and of course, older adults are facing increased hardships. You know, from the poll, you know, you all pointed out some hardships that seniors are facing. And there are in our four county service area, 377,274 households 65 and older. Okay. And so of that number, 144,993 are ALICE and 48,517 are in poverty. Okay. And so we've broken it out there to the chart to the right. Now, when we look at the population through a racial ethnic lens, the white non-Hispanic population in Texas is older than other racial ethnic groups and will continue to account for an increasing share of the senior population. Having lived through a decade of financial challenges since the Great Recession, more Texas seniors will become ALICE and more seniors will continue to work past traditional retirement age to make ends meet. Seniors also make up a larger portion of households in rural areas where they will continue to face additional challenges in access to transportation, healthcare, and caregiving. All right, so if we dive a bit deeper and look at the greater Houston area here, so we have the four counties broken out here, Harris, Montgomery, Waller, and Fort Bend. We see that over half of seniors are struggling to make ends meet there in Harris County. This means they're having to make difficult decisions like choosing between buying food versus medication, paying utilities versus paying their rent. You know, this is something that we hear on a daily basis from our 211 specialists. You know, they're hearing these stories day in and day out. So there are many older adults in our community that are struggling. You can see the breakdown of the service area here. Again, 53% in Harris, then in Montgomery, closely following with 50%, 47% in Waller, and then 41% there in Fort Bend County. All right, next slide. All right, I'm gonna turn it back over to Jessica.
Thank you, Shauna. So the other point around the ALICE data, and it's really unique to the ALICE data, is the survival budget. So the survival budget is specific to the county, state, and household size. It includes the actual costs of housing, childcare, food, transportation, healthcare, and technology. So it really looks at what does that family need to survive on a monthly basis. The household budget, again, is its bare bones, real world, conservative estimates of what it takes to make ends meet. It doesn't include things such as savings or frills in the budget. And so this is our family of three. You maybe have seen us talk about the family of three, where it's one single parent, one preschooler, and one school-age child that needs about $57,893 a month to make ends meet. So for their survival budget, the costly expenses for that family are housing and childcare. But the survival budget varies based on the location of the household, the size and composition of the household. So I want to share this, and I'm sure if you've come to some of our data and dishes, you've seen this kind of scan of the different survival budget based on size and composition. So how many people are in the household, but then also who's in the household. And so here we can see kind of right there in the middle, that family of three, where it's one adult, one preschooler, and one school age. But if we look at the left side, we can see the one person household. So whether that's a single adult or a senior adult. And so we can see there the difference start to come for that senior citizen, the older adult, where the single adult maybe needs 29,000, whereas the senior adult needs closer to 33,000. And then we can build and create bigger household compositions. And so that's also when we factor in multi-generational families all the way on the far right side, you can see that multi-generational family where there's 5 members of the household, let's say, with one adult, one senior, and then 3 children, kind of ranging in ages there. And their survival budget will be closer to 94,000, and that's in an annual. But we can also, oh gosh, backwards. We are going to go to Mentee, but that's really what's great about this survival budget is that we can adjust the survival budget to look at what does it take for a senior to make ends meet. So the senior has different costs for food than younger adults. They also have different, travel or transportation needs compared to other adults in their family or their household. So that's what the survival budget takes in. So I want to head you back over to Mentee real fast to do one more poll. So if you don't have your Mentee still up, please Please bear with me a moment as I go to that next question, but here we go. So we're going to go back over to Mentee, and you'll want to do this poll real quick for us. And what is the average monthly Social Security benefits an older adult receives? So you've got 4 options there. You have $1,543, you have $1,756, $1,949, and then $1,247. So that's the monthly amount that they might receive on average. Great, so have some polls coming in. It looks like the one that's getting the most vote is $1,247 on a month, on an average for monthly. Okay, that one is kind of getting in a landslide right there. Thank you all so much. I'll give like another moment if anybody else wants to go to the poll. So mentee.com, the code is 3936238, and the question on the board is, what is the average monthly Social Security benefits an older adult receives? Looks like everybody that wants to participate participated, and the majority has voted that it's $1,247. Well, actually, it is the first one. It's $1,543. So it's $1,543, which is the average an older adult collects in Social Security benefits, according to the SSA. So thank you so much for taking that poll and doing that one, because we really wanted to kind of bring that in to our knowledge when we look at the survival budget for the senior. So for the senior, the survival budget, they need about, at the bottom right there, they need about $27.73 a month to make ends meet. But the average adult collects $1,543 in retirement benefits. So that's a difference of about $1,200 that the senior needs to meet the monthly survival budget. And this really shows that Social Security is not enough to cover the basic household budget, and the gap between benefits and expense is getting wider. We know that Social Security helps, seniors kind of get over that federal poverty level, but there is still the gap between federal poverty and the survival budget, and really what does it truly take to make ends meet. So the senior survival budget more accurately represents the household costs for people over 65 years old. And then you'll see here the survival budget incorporates specific cost estimates for seniors for food, transportation, and healthcare, reflecting key differences in the household expense by age. So I want to show you that kind of in a side-by-side comparison. So here we have the single adult. We showed that earlier kind of in our scan of household survival budget. So you can see the senior adult, single adult needs $29,748, whereas the senior needs $33,276 annually. And so you can see in that monthly budget, where does it change? So housing stays the same, taxes, and so does technology. But you have transportation and food that decrease a little bit. However, you have healthcare, and then miscellaneous actually increase as well. Because over 90% of seniors have at least one chronic condition, the senior survival budget includes additional costs of treating the average of the 5 most chronic diseases like heart disease and diabetes. So while Medicare provides, crucial healthcare coverage, and many seniors could be far worse off without it, the benefit does not cover all healthcare. It's also notable that it omits most dental and foot care, eye exams and glasses, home health aides, and then most home health equipment. It also doesn't take into consideration short-term custodial care or long-term care. So if the senior maybe has poor health, they're going to have even more increased healthcare cost. The ALICE highlights the reality that these same benefits are often not at the level that enables financial stability. So this is especially true in some regions of Texas where the cost of living is high. This is reinforced by the fact that many seniors continue to work, some by choice and other because of low income. So I'm going to hand it over to Shauna to talk a little bit more about that.
All right, thanks. So, we looked at kind of the budget and what's needed to survive. And so what we want to take a look at now are some sources of income for seniors, and then discuss some of the health factors that they have. So when we look at the number of seniors that are still in the workforce across counties, we see some variation. Waller has 40% still working. Harris is there at 35%. Fort Bend 30%, and then Montgomery County 28%. And so I'm not sure how many of these individuals are working out of necessity, but I think, I can safely say that a number of them probably wouldn't be working if they didn't have to, right? So for those who have to work, many are living on fixed incomes. And for many seniors living on fixed income, it isn't a choice they made, but rather an assignment. Some of them might have encountered a life changing injury. They might have been employed for numerous years, hardworking, dedicated to their job that might have been low paying with limited or no retirement benefits. They might have been a single parent with limited lifetime earnings due to parenting duties. And increasingly, what we're seeing is that many may still have parenting duties while raising grandchildren. And so people may consider it a lack of planning, but when you realize that, many industries and careers don't promote or contribute to robust retirement planning, you begin to understand why so many elderly are struggling. And so the ALICE report shows us that a senior needs roughly $16.64 per hour just to survive. Okay, 16.64. Now think about the types of jobs Alice has and how many of them pay 16.64 an hour. I started thinking about jobs, and I even went on Indeed to look at, jobs that paid $16, $17 an hour. And now think about those types of jobs and then consider how many seniors could work them on a full-time basis without any issues. Okay. So, on a national level, 1/3 of senior households has no money left over each month or is in debt after meeting essential expenses. And so, Americans age 65 and older earn on average $1,018 per week or $52,936 per year. And so, I really want to note that this average is for full time workers. So it doesn't consider the many people in this age bracket who work lower paying jobs or drop out of the workforce to begin taking from Social Security or their retirement benefits. Okay, so that stat comes from the Bureau of Labor Statistics. And then the Elder Index and the Institute on Assets and Social Policy Senior Financial Stability Index shows us that millions of older adults struggle to meet monthly expenses, even though they're considered poor because they're not considered poor, excuse me, because they live above the poverty level. So many older adults are house rich, but cash poor. So meaning they own their homes, but they're fighting to survive due to limited income, which sometimes leads them, and sometimes, applying for reverse mortgages, which can cause more harm than good if they're unable to meet the loan's obligations. Sometimes it might result in foreclosures, high closing costs, effects on benefits and heirs. If they don't know how to budget that money, appropriately, they might exhaust funds too quickly. And so, reverse mortgages aren't always the best route to go. So, additionally, an increasing number of elderly apply and receive loans, and this is both bank and predatory, just to ensure that they can pay their bills and meet monthly living expenses. And in Texas, Texas is one of the 10 states with the highest rates of uh, senior food insecurity. So we have seniors that don't have the means to even buy food on a regular basis or don't really know where their next meal is coming from. And so finances play a huge part in looking at, what it takes and then, how an elderly person is able to survive in our current, economic landscape. So when we consider Social Security income on a national level, 21% of married Social Security recipients and then 43% of single recipients age 65 plus depend on Social Security for 90% or more of of their income. And so when I saw that stat, I was kind of blown away because I did not realize that 90% or more of folks are depending on Social Security for their income. So in Texas, an estimated 2.8 million retirees collects payments from Social Security. And when we look at the state's average benefits for 2021, it's going to be $1,515 per month that a senior will collect in Social Security benefits. And that is roughly $18,181 for the full year, which is below the national average of $18,259. Okay. Now that's 6,000 above the federal poverty line. And so, like Jessica stated, they're above poverty, but they're still not able to survive. And so you compare that to the $33,276 per year that, is needed for that survival budget, they're $15,000 short. Okay. And so, without the many policies and social service programs in place to help seniors financially, like Social Security, property tax deductions, exemptions based on age, senior discounts, both, private and publicly, many seniors would fall below that ALICE threshold. All right, next slide.
Hey, Shauna, while we're, before we go to the next slide, there is a question in the chat. So I'm curious if you saw this in your readings or in your research around how much can a senior make working part-time before SS benefit is reduced?
I'm not sure. I can look that up quickly and drop it in the chat. I know that if you're younger or if you retire before retirement age, I think you can earn up to, I think it's like around 18,000 a year. But I can look at what that looks like if someone's working on a part-time basis.
Great. Thank you, Shauna. I also know there's some calculators too through the SSA where it's just like you described, right? Like depending on your age, depending on this and that, it'll calculate like what is your unique factor for what would working part-time look like and how your SS benefits are reduced. And we can, also share that kind of as a resource after the session as well.
Awesome. All right, so keeping in mind, we've looked at the survival budget, we've looked at income. Let's take a look at these healthcare costs. So a single older adult in good health needs between $3,972 and $4,224 annually, depending on whether the person pays rent or mortgage to meet healthcare costs. Now, when you look at a single older adult in poor health, they need between $6,420 and $6,756 annually, again, depending on whether they pay rent or mortgage to meet their healthcare costs. So within our 4-county service area, again, Harris, Montgomery, Waller, and Fort Bend counties, there are 687,069 people living in those 4-county service areas that are 65 plus. So of that, 97% have health insurance and 3% don't. Okay. So not too bad, but still you have a portion of the population who don't have health insurance, right? That's almost 21,000 folks. And so when you're looking at healthcare, of course, there are a lot of information, but wanted to give some quick healthcare facts with regards to the senior population. So when we talk about mental health, 1 in 4 older adults experiences some mental disorder, including depression and anxiety disorders and dementia. This number is expected to double to 15 million by 2030. Depression affects 7 million older Americans, and many don't receive treatment. 2/3 of older adults with mental health problems don't receive the treatment that they need. When we talk about substance abuse, untreated abuse and mental health problems among older adults are associated with poor health outcomes, higher healthcare utilization, increased complexity of the course and prognosis of mental illnesses, increased disability and impairment, compromised quality of life, increased caregiver stress, and higher risk of suicide. People aged 85 plus have the highest suicide rate of any age group, with older white men having a suicide rate almost 6 times than that of the general population. And now if you move to physical health, the chronic diseases account for 75% of the money our nation spends on healthcare, yet only 1% of health dollars are spent on public efforts to improve overall health. Approximately 80% of older adults have at least one chronic disease, and 77% have at least two. And so, for chronic diseases, heart disease, cancer, stroke, and diabetes cause almost 2/3 of all deaths each year. 90% of Americans age 55 plus or at risk of hypertension or high blood pressure. And then among older adults, falls are the leading cause of fractures, hospital admissions for trauma and injury deaths. And then falls are also the most common cause of older adult traumatic brain injuries, accounting for over 46% of fatal falls. And so when you consider the costs that are associated with healthcare and treating different types of illnesses, you can clearly see how much more difficult it might be for a senior, especially those who are living on fixed incomes, to budget for medical needs. Additionally, when talking about social determinants of health, like, where a senior lives, where they work, their level of education, access to healthy foods and quality health care, that's a whole other layer, right? And those can place additional hardships and significantly impact the senior's ability, to not only live independently, but just to survive, right? And so it's really important to remember that, you know, as we age, of course, healthcare in most instances increases. And so it can definitely become an issue for our senior population. All right, next slide. And so we looked at this a little bit earlier. The survival budget, of course, changes based on the household size and composition. Again, the size, meaning how many folks are in a home, and then the composition, meaning the characteristics of those living in that home, whether they're adult, school age, and infant, so on and so forth. And so the ALS report does provide us with several budgets and has added a new senior household budget with data available by age for food, transportation, healthcare. We're able to better differentiate the cost of senior households. So looking at a few of these budgets, we can see how the survival budget increases again from that single adult of $29,748 versus a senior adult, again, requiring $33,276. We see that increase. But then when you go all the way over to the far right of the screen, the budget increases as the household composition becomes more multifaceted. So when you're looking at the one adult, one senior adult, the school ager, and the preschool and infant, you're needing $94,326 a year just to survive. Okay, next slide. So when we break down that multi-generational budget, again, that one adult, one senior adult, one school ager, one preschooler, and one infant living in a household, you're needing about $2,500 for housing, $1,258 for childcare. That food budget is now $987. Still got to pay those taxes. Miscellaneous at 707, transportation 629, and then technology is decreased some at $75. And so on a monthly basis, $7,861 is needed in order for a multi-generational household to survive. And when you think about that, if you're looking at one adult and then one senior adult living in the home, who's to say that senior adult is working? Or has some retirement or Social Security benefits coming in, and then you compare that to the hourly wage that's needed, that's $47.16 an hour needed. Okay, next slide. And so we know older adults are living in multi-generational families or with another unrelated older adult. 26% of Texans 60 or older live in a multi-generational home. And so just wanted to point out a few data points related to multi-generational households. So in Texas, approximately 697,000 children who are aged 18 or younger live with a grandparent. In Harris County, it's estimated that 106,106 grandchildren live with a grandparent. 47,322 of these children, the responsibility of care lies with their grandparents. And for 13,568 of these children, also, their parent is not present in the home. Okay, so we're looking at seniors who are having added responsibilities, not only raising, their children, but also now raising their grandchildren. A grandparent raising a grandchild in Texas or Harris County is almost twice as likely as the national average to be raising that child in poverty. And so, approximately 1 out of every 50 adults over the age of 60 in Harris County and in Texas is a grandparent who is financially responsible for at least one grandchild. And then nationally, that figure is closer to 1 out of every 63. And then nearly 1 in 5 seniors living with grandchildren is food insecure. So, we know families can benefit from living in multi-generational homes. In fact, many prepare for the day that, they will live in a home with a parent or grandparent. But if your household is Alice, these benefits, might be harder to achieve. Okay. All right, next slide. All right, we're going to have some discussion, and I'm going to kick it back over to Jessica to lead us in this part of our agenda.
Great. Thank you so much, Shauna. Before we go into the discussion, I did want to pause and see if anyone had any questions. I know we kind of dropped a lot of information on your lap, so I just wanted to pause for a moment to see if there are any questions. I'll also try to scan the gallery to see if anybody is raising their hand that way as well. Okay, I'm not seeing anything come through the chat or anybody raising their hand or raising their virtual hand or raising their physical hand. So, but oh look, Shauna's looking up the Social Security benefit question right now just to get more specifics on that. Even though it is, there'll be more insight from there. So feel free to use the chat though if you have any other questions. So we want to use this moment now for more of a self-reflection, and then we'll have a large open discussion about this. So we have 3 questions posed because we really today wanted to bring to light or to greater light the economic insecurity is pervasive among Alice households and with seniors. And so we really hit on quite a bit different avenues and different ways that it intersects, and really just quantifying the problem can help the stakeholders, help programs, help communities best decide how to fill the gap, how to address this growing issue. So our 3 questions we wanted to pose today for you to self-reflect on, then we'll have an open discussion, kind of hear from people on what they're thinking. What do you see as the biggest need for seniors? How do you accommodate seniors in your programs or in your work? And then what can our community do to support seniors? So it's 12:39. We'll give until about 12:44 for you to just kind of self-reflect, write yourself a couple of notes, because we really want to hear from you guys on what you're seeing and what from your lens we can do. I will drop these in the chat as well.
And I've been working in the aging space for, 40 years. And so to Shauna's question about where will you be in 10 years, I will clearly be in the retired category and happy about that. I think, so a couple of things strike me about these questions. One is, and I totally agree with what Linda said, and we've serving certainly thousands of older adults right now with meals. And the isolation is incredibly painful and powerfully impacting them. But I think the thing we want to be careful about is when you ask about biggest needs for seniors is that we don't glump them all into the same category. So if biggest need for an older adult who, has health conditions and is in poverty, I mean, that's a different kind of need than another older adult who may be still working. And so I get it's been kind of one of my bandwagons for a long time, but I think it's really important that we don't generalize all older adults in the same bucket. I think that's one thing. The other thing I would just comment I would make is, and so just one of the things that I'm most proud of that Baker Ripley's doing to accommodate seniors, in addition to the meals we're delivering now and our dementia care work, is that we teach a whole host of evidence-based health promotion programs that are very targeted at helping people manage their chronic disease. So I'm really proud about that. And then I think the other general thing we want to be thoughtful about, and it may not really be true for where United Way is going now, particularly in light of the ALICE kind of definition. But I think if we don't really work as a community toward giving older people opportunities to give and to feel valued and to feel part and to have a sense of purpose, we are affecting all of those other areas of their lives that are just, that create a downward spiral. So kind of regardless of circumstance, whether you're homebound or you're active, I think what our community can do is to create more opportunities for older adults to feel part and as a valuable contributor. Thanks for letting me go off on my little bandwagon.
No, I appreciate that. Thank you. And I think I see Tracy in the chat as well, agreeing with you about more need for meaning and purpose. And I really appreciated you bringing that up, because I think that's really something that's underestimated or under-resourced as well. And so it's something to definitely take a careful lens and look at. As well as, I did think of you guys, and I believe it was y'all that did does, the health promotion, knowledge trainings, but then also kind of how to use technology for an older adult. So that also came to mind as, the resources that are out there or that are also just needed for seniors to be able to thrive in our community and in their homes as well. There's another thing you said too, and I really appreciate it. We just kind of threw out some broad questions, what is the biggest need for seniors? And you're 100% right. Every senior is so different and so unique and so individual. So it's what's that individual need? It'll look different for each senior. So I appreciate you bringing that up, because it is very individualized. Great. And I see some more. Oh, Shauna answered the question in the chat. That's a pretty long answer, so I'll let you read that if you're curious. But I did hear, Shauna, did you want to add a little more content to your chat?
No, I put it in there, but basically, and it reads, if you start benefits prior to full retirement age, you can only earn up to $18,960 and get your full benefits. And then once you get your full benefits, once you earn more than the limit, then they start deducting $1 from your benefit for every $2 you earn. Okay, so then in the year you reach full retirement age, Social Security becomes more forgiving. If you earn more than $50,520, it deducts $1 for every $3 you earn, but only during the months before you reach full retirement age. Once you reach full retirement age, you can earn any amount of money and it won't reduce your monthly benefits. And so what I did is, so if you're a senior that earns the $18,960 and then you add in the average Social Security benefits for Texas annually, $18,180, that gets you $37,140. So that's over the survival budget of the $33,276, but that means that they're going to be working forever and ever. So, yeah.
Great, Shauna. Thanks for sharing that info. Definitely something to kind of think around, and how does that impact the ALICE senior? So love to, continue on this conversation. Would anyone else like to share some of their reflection they had from today's session? Feel free to just go ahead and unmute if you do. I'm trying to scan to see if anyone raised their hand again. Especially would love to hear, how do you accommodate seniors in your program? I know Jan mentioned some of the things they're doing at Baker Ripley. If anyone else has any programs geared specifically for seniors or adapting their programming for seniors, find this an opportunity to also learn and share from one another.
I know working with some of our senior affiliates, and this is something that kind of came out during our conversations with volunteers, and it's kind of to Jane's point too, you know, we talk about this idea of, you know, seniors and them being frail, but, you know, what about those seniors who are, you know, very active, they're living on their own, they're still driving. You know, I know folks that are like, I have one of my mother's cousins is like 90 and still driving himself to church and things like that. So really looking at how we can, you know, tweak our services or cater to those seniors also, not just, you know, the frail and those who, you know, need, you know, the constant services, you know, day in and day out.
Yeah, definitely. It reminds me of like every senior is unique, every senior is individual.
Mhm.
Just that call from Jan. So thanks. Thanks, Shauna.
Hi, this is Jen again. This is terrible because like I could like talk about this stuff. This is like truly what I'm all about. But I think the other thing we have to be mindful of, even if we look at frail older people, even though their numbers are far less than the broader population of older adults, we have to look at what they've got to, what other resources they have access to. And our long-term care system in this country and in this state is on very, very fragile ground. And so as those healthy, active older people experience increasing health issues and health challenges and then become potentially in need of help in their homes, it's expensive. And we do not, as a country, and particularly not in this state, do we have a strong kind of safety net of home care. We've got services. I don't get me wrong. I'm not saying the state doesn't do anything, but the need is so much bigger. So I think that when I think about biggest needs, I do think about this kind of home and community-based long-term care services that allow older people to remain at home with some supports.
Yeah, definitely. Marcus, were you saying something? Or are you?
Yeah, good afternoon. My name is Marcus Hicks, and I'm with the Montrose Center. And so I want to touch on a couple of things that I've heard and from the briefing and everything else. One, the social connectedness and the importance of giving purpose to community members, especially across all age groups, I think is really LGBTQ seniors moving in there. But we're also trying to make sure that not only do they have a space that co-locates the health and mental health assistance they may need, but also gives them access to those social connectedness points. Now, especially right now with COVID, there's a lot more safety concerns we're taking into account. Right now, we're having people move in at a very slow rate, one, so that we can make sure that they're getting into their apartments safely and with the most consideration for what it takes to move in. The ability at the center to both do things for themselves as a community and with the younger generation that they will have the opportunity to pass their wisdom to. I mean, I think as we look at especially LGBTQ communities and communities of color, where some of the seniors fought battles that our youth now are having to either re-engage or figure out how to navigate from a different perspective, right? Those lessons learned that come from our elder community, celebrating those and giving them opportunities both to feel empowered to share them and to then impact the minds of the youth coming up and then help them avoid the pitfalls and traps that sometimes come in the community are very important. And we're trying to figure out how to capture all of that wisdom and then continue to share it and pass it. I think opening up the volunteering side of that house for on the youth side, or maybe not even youth, but let's say young adult to millennial generation side, to both then reach back to our seniors and encourage that connectedness is just as important. And that I think is opening up that door for communication to both empower our seniors and give them a sense of community and a place in it, because the social isolation is one of those things that's really impacting not only the mental health, isolated apartments, eating cat food. And it wasn't until somebody from our volunteer staff went and like checked on that senior at their house and found out that's what they were doing, that they were able to provide some of our food insecurity programs to help them. So those are things we just like to think about and figure out how we integrate into everything we're doing it.
Great, thank you, Marcus. You were a little broken up there, but I definitely feel like the things that from the bandwidth issues, but it was definitely a lot of things were still shared there that I know definitely resonated with me, and kind of intersecting how, you know, the way others were sharing, but also just this empowerment that is needed too. So I appreciate that. I appreciate you bringing to light bringing that to light and lifting that up. We have probably about 6 more minutes. Would love if anyone else would like to share out as well.
Not all at one time, y'all.
I know, huh?
I know you have all kinds of wisdom in those heads of yours.
Hey, Jessica, this is Tracy. Can you hear me?
Yes. Hi,
Okay.
Tracy.
So kind of keeping in mind, you know, the points that have been made about how, you know, not all seniors are alike. It's just like any community. I think it is important, and something that I know at Family Houston we do to accommodate our seniors, and it's been said already, is just really understanding the resources available within our case management program. You know, making sure that we really understand what is out there for the senior population, what they're able to tap into, because I think that sometimes, you know, we can be an advocate for them, and also just a point of information. But also something that I noticed, and it may not be all seniors, but within our program at Family Houston, really the seniors that come in, the way that we accommodate them is by just truly showing them that we care for them. I think that it's not just specific to the senior population, but we see it a lot with our seniors, that they want to know what you can inform them about or help them with, but really they truly want to know that you care, and they will continue to seek out services at your agency if they get that feeling of caring and compassion. And I know within our case management program, we have case managers that have been working with some of our seniors for several years, and they think of them almost as like extended family. You know, they come and check in with their case manager, and it's like checking in with a family member, because they know that there's that connection. And there's so much going on in our community, trying to scam seniors or do things that are not in their benefit. And so having a place that they can trust, that they can reach out to, that they know this person really has my best interest at heart, I think goes a long way. And that's just like the starting point for being able to then connect them to these valuable resources.
Thank you, Tracy. That's a really great kind of last comment to end on, considering we're about 3 minutes out, and just being mindful of this hour we have together. You hit on a lot of great points about resources, hope, and caring for individuals and seniors. You know, United Way, we have our ESPN, so our Elder Service Provider Network meeting that happens monthly. We'll definitely be able to make sure to share that resource out with everybody after the session as well, so people can tap into that network just for resources. And something you said really kind of brought something Marcus said that I forgot to mention that I really appreciated, was that how are we integrating this for seniors? How are we integrating seniors into our programming, not having, you know, yes, we have some wonderful standalone programs, but also in our other programs, how are we making things accessible, integrated? I really appreciated that, because it kind of, for me, tied what you and Marcus both said together. So thank you. And thank you so much for everybody who shared. Really appreciate these sessions as just being a moment for us to kind of come together, kind of hear the brief on ALICE and the intersection of the topic, which today was for seniors, but then also just to kind of learn from each other and share, how do you see this in your lens and in your work? So we have 2 more ALICE sessions to go for our Data and Dish series that we have. We have the benefits of sufficient income in February. And then in March, we have ALICE Data for Action. Both of those are really going to be interactive. We'll have breakout sessions. We'll really be talking more than, you know, presentation PowerPoints for those. So hope you'll be able to join us. We'll send the RSVP links out if you haven't already RSVP'd, but please share your feedback before you go. We have about 2 minutes left. If you could take those last 2 minutes to just give us some feedback. We always are wanting to make sure these sessions are valuable to you, but then also that we're, you know, improving these sessions as we go, to just do our own little CQI on the work we do here at United Way. So thank you
Hey,
all so much.
Jessica, this is Jane. I'm sorry to interrupt. I just want to say to you and to Sean and to United Way that I am deeply grateful that seniors are not getting left out of the conversation going forward. And so I appreciate your initial comments because I was one of those first people. I was calling anybody I knew at United Way. What are you talking about? When are they not working? Kind of thing. So I just really, as somebody who's worked in this field for a very long time, I know we don't know what the end result will be, but we've been incredibly anxious in our space about the loss of support from United Way and for this population. So regardless of what it turns out to be in a number, I just want to publicly thank you for not leaving out older people. So I just want to say that. Thanks.
Thank you. I appreciate that. And that's why I made that out the gate, my comment. And that was why when we were slating these different, what's the topic going to be for Data and Dish in our series, I was like, we have to do one on seniors. We have this senior survival budget now, and that really can just demystify this myth that seniors aren't ALICE, because they are ALICE. They are probably even more ALICE than, other age groups. So I was really glad we were able to bring that to light. And I know there's all kinds of other special populations that we could definitely do an ALICE session along with as well, because ALICE intersects with every population, whether it's LGBTQ, veterans, individuals with disabilities, whether that's an adult or a youth, they all intersect. So if that's what you want, put that on the feedback form and we will make it happen. So just really appreciate y'all's time today. And thank you so much for joining us.
Thank you.
And thank you, Shauna.
Thank you all. A lot of information crammed into an hour, but we did it.
We did it.
And Jessica, you did say y'all were going to be sending out the slides, didn't you?
Yes, I'll send out the slides to everybody who registered. So you'll get that probably here. You get the slides and then this recording.
Awesome. Thank you. Thank you very much. This was another great session. Cool.
Thank you. Great to see you, Marcus. Yeah, hope
You
you're doing
too.
well.
Cool. You too. Happy New Year.
Happy New Year. Yeah.